Friendly, sad mommy. Okay, another newborn-related subject, and thank you to Dr. Danny, PsyD. And away we go. Perinatal mental health disorders include perinatal mood and anxiety disorders, or PMADs.
But first, remember that you can find us on our website, which is podcastpediatricians.com. For this episode particularly, if you're a newborn maternity nurse or know a lactation consultant or a new mom-to-be, please share it. We can also be found on iTunes, Google, Stitcher, and now newly on YouTube.
Our disclaimer, Matt.
We're sharing our own personal opinions on pediatric care. Always talk to your own pediatric caregiver about your child. Pediatric caregivers should always consult expert guidelines and consider their own community standards of care.
For this discussion, the perinatal period is defined as the period between the end of pregnancy through the first year after giving birth. The perinatal mental health disorders include postpartum depression, which does exist despite, as we mentioned last season, Tom Cruise's expert opinion otherwise. And to reiterate, the podcast pediatricians really love Brooke Shields.
Actually, Rob really loves Brooke Shields.
I really do.
I'm much more of a Charlize Theron kind of guy.
Okay.
Yeah. So postpartum depression can be mild, which is called dysthymia, and it can also be quite severe and can even include bipolar disorder. On average, anywhere from 12 to 20% of pregnancies are associated with postpartum depression. But a less well-recognized and publicized entity is postpartum anxiety, which is seen in up to 15% of pregnant and newly delivered women, and also post-traumatic stress disorders in up to 9% of women are seen. Yes, and even psychosis at 1%. Now, psychosis is the rarest of these, but in a lot of ways is the most devastating, and the effects can last beyond the perinatal period too. Have you ever seen this, Rob?
I have. I've had one patient with it, and it was really an awful experience for everyone. I just felt so bad for that family, for that mom. She did recover from it. I know someone who the psychosis lasted for years and years. So this is not common, but it exists, and it's really needs to be identified and addressed quickly.
Yeah, like so many things in medicine, the sooner the better, but particularly when there's not just one person involved, but there are a minimum of two, the mom and the baby, and oftentimes the entire family.
Right.
So postpartum depression is more than just the baby blues. The baby blues after delivery can occur in up to 75% of new moms and can last a few days to a few weeks. These new moms are mostly happy, but they can have some crying episodes and episodes of feeling overwhelmed, often due to hormonal changes and lack of sleep. In contrast to the baby blues is postpartum depression, and this is really a constant, continuous, overwhelming sadness and a feeling of isolation and worthlessness, and it's often associated with a lack of connection to the newborn, coexisting with anxiety. These moms may just want to run away. Like many other times when somebody's in an anxious situation, it's just kind of like, get me out of here, I just can't take this. And it's really heartbreaking to see and really puts us in a position, if we are able to recognize it, to really try to reach out to these moms. Unfortunately, it's not always obvious to us. Imagine feeling this way while everyone around these new moms expects them to feel happy because they have a new baby. And isn't that absolutely wonderful? And often this entity, again, this anxiety is missed, and we're just as guilty, if not more guilty, than everybody else involved with a mom's life at that point.
Absolutely. Now, postpartum anxiety is extreme worrying about everything, with some combination of irritability, insomnia, shortness of breath, and palpitations. The constant worry can express itself in the what if this and what if that of new moms about the newborns. If we, pediatric caregivers, casually remark that the baby looks a bit skinny or is a little bit yellow, it can set off huge anxiety bells and whistles for these moms. And you see that, right?
Yeah, I always, as the further I get along in my career, the more careful I am with the specific words I used, because I'll have people who are now even grandparents who are coming back with their children's child who I had seen their children, and they'll say to me, I remember when you said blank. So I try to really reiterate to the people that we train in the office, whether they be nurse practitioners or residents, that you really have to be careful with the words you use, because the smallest thing somebody's going to remember and latch onto, and that's particularly true of new mothers.
I've always over the years more and more made it a point that when I go into a hospital room of a new mom with her newborn, or even those first couple of weeks in the office, to always first ask mom how she's feeling and doing. Not ask about the baby, never ask about dad, but ask about mom. Because she often is the most high-risk person in the room. But speaking of that first visit, do you ever notice that when you first go in there hours after delivery, sometimes moms can be glowing and serene and smiling while dad is like fast asleep and kind of moaning about how tired he is? It's kind of lame. You kind of think that that's why the Y chromosome is failing, because after a delivery of 12 hours, the dad's the one that is just totally destroyed.
There's the dad completely sacked out, kind of next to the mom, covering their head with a pillow when you're trying to talk.
Do you want to hear about your baby?
Yes. No, I'm really trying to catch a couple Z's here, man. Could you keep it down over there? Yeah, that is not at all an uncommon type of an experience.
And I think we both try to acknowledge over and over again that mom must be tired and sore and maybe happy sometimes and not happy other times. And later in the first few weeks, I always ask new moms if they've been away from the baby outside of the house. The answer usually is no. And then I turn to dad and say, have you been away from the baby outside of the house? And the answer is always yes. And that's my way of stressing that it can be helpful for moms to get away from the baby and get a little bit back to themselves, but only, of course, if they want to. But it's important that dad and grandma hear that mom needs to have some time on her own if possible.
Yeah. So the American Academy of Pediatrics recommends that we screen moms for postpartum depression at the ages of 1 month, 2 months, 4 months, and 6 months at those infant visits. And the main screening tool is the Edinburgh Postnatal Depression Scale, or the EPDS, for postpartum depression. It was developed in 1987 and takes about 5 minutes for the moms to fill out. For you pediatricians out there or other providers, you can use the billing code of 99420. But having said that, from what we understand, it's hard to get this reimbursed.
Are you doing this, Matt? Are you doing this screening?
So no, we're not doing it, embarrassingly so. I think we need to at least be doing something in our practice to try to address this. What do you do, Rob?
I can't believe you're not doing it, Matt, because we don't do it either. And actually, it doesn't really get reimbursable either. I agree with Matt that it's beyond that, and we'll get back to the time it takes. But sometimes we learn as we do an episode and change our practice, and I think this is going to be one of them. But tell us more about the EPDS.
Yeah, so each of the 10 questions have 4 possible answers that are scored on a 0 to 3 scale, so that the maximum score is 30 and the minimum is 0. And a score of 0 to 8 means that there's a low potential for postpartum depression, whereas 8 to 12 means likely more of a baby blues situation, 13 to 14 possible postpartum depression, and make sure that we're taking precautions to recognize that. And a score of 15 or more, there's a high probability of depression. A score over 20 is a real red flag for depression, or if there's possible suicidality or psychosis, then immediately accessing crisis intervention services or strongly recommending them is really what a pediatrician should be looking to do. If you do the screening, what you really need to know is what your resources are in the community for helping a mom, which certainly can include things like touching base with her obstetrician or her primary care provider, or community resources for maternal support systems for postpartum depression. In Delaware, we have a group called the Mother's Space, which is really wonderful, a place where moms can come together in kind of a compassionate and a supportive way, and it really seems to be a great add to our community.
Yes, I just used them this past week and referred to them, so they're a great resource. But there's great resources all over the country for that. Getting back to that screening program, they say it takes less than 5 minutes, but likely would take a good deal more time. And it is, to be honest, it is tough to fit everything into those visits. Although we need to, the Academy of Pediatrics also recommends an alternative. If you don't do the EPDS, you can do a simple 2-question screen. Question 1, over the past 2 weeks, have you ever felt down, depressed, or hopeless? Question 2, over the past 2 weeks, have you felt little interest or pleasure in doing things? Now, I think these 2 questions can easily be put into our templates for these well visits, and I've asked our guru, Dr. Siobhan, to put them in to our templates, and I suspect you will do that too.
Yeah, that or something like it. I do think it needs to be part of what we consider in terms of the entire family's health, mental health and otherwise.
Now, there is an anxiety screening inventory called the Burns. It has 33 questions, and I don't think it lends itself to office screening right now. But again, remember, postpartum anxiety is almost as common as depression, and we need to be aware of it. And if we see very anxious new moms more than usual, we need to look to get her support. In the October 2017 Pediatrics Journal, there's a great article by Dr. van der Zee van den Berg. Yes, that's the full last name of this one person.
Also known as Little Stevie.
With 6 sections separated by spaces or hyphen. For the record, his first name is Anne Gareth, not Gareth like the original British Office. You don't know that, but I digress. No. Anyway, in this study from the Netherlands, Dr. van der Zee van den Berg did similar newborn screenings that are recommended at the 1, 3, and 6 month visits, well-child visits, in over 3,000 mother-baby dyads, with interventions for moms who seemed to have postpartum depression that was picked up on these well-baby screens. Then when the babies are 9 months of age, they looked at all these moms, and 8.4% of the moms who were not screened during the baby well visits for postpartum depression had depression, versus only 3% of the moms who were screened for depression in the well visits of their children and given interventions appropriately at that time. So a huge benefit of screening for postpartum depression. And why should we care so much as pediatric caregivers about some untreated postpartum depressions in moms? Well, because this greatly increases the baby's behavioral issues, cognitive delays, and impairment of attachment to the moms. Again, in pediatrics, we're all about prevention, and this is a great way to prevent problems in their children and, of course, help the moms.
Okay, so we covered the sad mommies part. But what about those baby-friendly?
Yes.
Mm-hmm. Well, it's well known that a major trigger for postpartum depression and anxiety for new moms is breastfeeding dilemmas and difficulties. We see this all the time. It can be so hard for new moms. There are so many expectations put on them by family and especially by grandmoms about breastfeeding. And also there is plenty of pressure put on moms as part of the whole kind of current mythology of what a woman should be and what a mom should be, that new moms need to do everything perfectly. And this is really fueled by a lot of chatter on the internet that's supported honestly by some doctors and midwives and lactation consultants and various activist groups and other moms really putting the pressure on moms in terms of all the different aspects of breastfeeding.
Yeah, there was a great cover article in Time Magazine, October 30th of 2017, called The Goddess Myth by Claire Harworth, and I recommend anybody out there read it. But again, this goddess myth promotes that new moms' bodies are a temple and that anything less than completely natural childhood and only breastfeeding is failing the baby. So epidurals, C-sections, a little bit of formula supplementation, and even medications to induce vaginal births are frowned upon and considered a defeat. There can be a lot of mom shaming fueled by misinformation on the internet. The goal should always be to have a healthy mommy and baby, and there's a lot of ways to get there.
Yeah, I always talk to parents who both, and it's generally the moms who are really struggling with this, but both the moms and the dads. And sometimes you just have to bring them back to earth and say, hey, listen, why did you have your baby? You know, you had your baby to make a family. You had your baby to enjoy each other's company. You had your baby to build a life together. You didn't have your baby to suffer. And when you've gotten to a point where you're really feeling overwhelmed by the pressures on you, which can be both subtle and overt by relatives and by the media and by society in general, we really have to take a step back and look at the big picture.
Right. And bottom line, hundreds of years ago, when we did not have things like C-sections and induced vaginal births and pain medications and quality formula, a lot more mothers and babies died.
They did.
Look at the statistics.
Yeah, they did. So, and that's not a coincidence either. So this brings us to that baby-friendly hospital initiative, or the BFHI, which was established in 1991 by the World Health Organization to promote breastfeeding for at least the first 6 months. They certify certain hospitals as being, quote, baby-friendly, and this is a very coveted certification of the over 450 hospitals in the USA that deliver over 20% of the babies in this country. It costs about $10,000 to $12,000 just to get certified, and this is paid directly to Baby Friendly USA Incorporated. So to be a baby-friendly hospital, or to be certified as a baby-friendly hospital initiative hospital, one must follow all of their 10 steps. Number 1, have a written breastfeeding policy routinely communicated to healthcare staff. 2, train healthcare staff in skills necessary to implement the policy. So far, so good. 3, inform all pregnant women about the benefits and management of breastfeeding. Good. 4, help mothers initiate breastfeeding within an hour of birth.
Still good?
Still good. 5, show mothers how to breastfeed, how to maintain lactation, even if they're separated from their infants.
All right.
I can abide by that. Number 6, give infants no food or drink other than breast milk unless medically indicated. We'll come back to this one.
Yep.
Okay. Number 7, practice rooming in. Allow mothers and infants to remain together for 24 hours a day. Reasonable.
Yeah.
And we'll come back to that again.
Yeah.
Number 8, encourage breastfeeding on demand.
Great.
Number 9, give no pacifiers or artificial nipples to breastfeeding infants. We'll have something to say about that in a minute. And number 10, foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or birth center.
Okay.
That one sounds good to me. So overall, we support this mission and the goals and almost all of its rules. Right, Rob?
Yes. And almost being the key word. An editorial in JAMA Pediatrics in October 2016 caused quite a stir in the pediatric world when a Dr. James Bass, a pediatrician from Newton Wellesley Hospital, Massachusetts, plus a few of his colleagues, criticized Baby Friendly. This included the head pediatrician at Mass General, which is an okay, decent hospital, right? You agree? It's okay.
Yeah, I mean, aside from being in Patriots football country,
Exactly.
it's a stellar hospital.
It's not the Philly area hospitals, but they're all right. They're all right. So, this Dr. Bass and his colleagues kind of ripped some parts of the rules of Baby Friendly. Some highlights included that they felt number 7, the absolute rooming in 24/7, could be dangerous with a very tired, exhausted mom, perhaps on pain meds, in a room where the nurse couldn't be there 24/7, that the babies may end up prone, sleeping, or smothered, or fall off the bed. Now, I've not encountered any smothering issues in our hospital, thank goodness. I don't think Matt has either. But our maternity ward has had babies fall off the beds, and moms do fall asleep with the babies in unsafe positions.
Oh, yeah. When I was a resident, I ordered at least a half a dozen skull x-rays on babies who had fallen to the ground just off of an exhausted mom's lap. And I think one of the things that we don't recognize these days is that so often traditionally, moms were part of a large extended family whom all lived in the same area, and the grandmothers and the aunts were right there at the time the mom delivered and continued to help to care for her over the next several days. Now, instead of that, nurses have, for the most part, taken that over in the U.S.
Or the dad who, as we talked about, is passed out moaning in the next bed.
Right.
Encouraging rooming in overall is a good thing. I think we both agree.
I agree with that.
However, there needs to be more room for discretion by that maternity perinatal nurse. And these are excellent nurses. They care for both new moms and babies. They're caring for 2 different people. And as we said, we love working
They have
with them.
an
They're
amazing
wonderful.
skill set. They really are sensitive and knowledgeable people. And these are the types of people whose discretion you want to defer to when they think that they need to step in.
I've also read that this was surprising, that there's a movement to close all the newborn nurseries on the newborn floors. So there's no other place to put the babies if not in the mom's room. And that's a terrible idea. I just think you got to have some place. There's always situations where you might need an old traditional nursery. I know where it came from because we also trained the time that often there would be overnight nurses who would just give every baby a bottle in the nursery, even if the parents did not want to.
Glucose water, usually.
Right, glucose water. So that was wrong, and I think that's been addressed, and a lot of Friendly Baby addresses that. But you can't go all the way to the other side and make it so there's no possibility of the baby being outside the mom's room if the nurses feel it would be safest for the baby.
Yeah, I mean, sometimes moms do need a break, and or it's dangerous to keep the baby in the mom's room without 24/7 supervision, somebody helping out at least. So again, the mom just went through a major traumatic and a wonderful experience. Although as wonderful as it also was very exhausting. And each mom responds to this differently. The nurses who are perinatal nurses are in the best position to judge if it's safe to have a baby in with the mom 24/7, and whether or not they need a place to watch the babies. If it's not wise, that really is something that we need to, again, defer to the nurses. So we really need to save these nurseries.
Save the nurseries.
Save the nurseries. Yeah, they are still an important part of, I think, the options that are available to the nursing staff at the hospital and the moms as well. So another point that was made was that the prohibition of any pacifiers might increase the risk of SIDS, since pacifiers can reduce SIDS risk, and this has been proven now in multiple papers. But we agree it should be used rarely and judiciously in the first few weeks. But occasionally you get a baby that just needs to suck on something. I mean, these are non-nutritive. That's right. the other version of that. These are non-nutritive sucklers, and believe me, I had 3 of these kids living in my house when they came home as babies. You know, as successful as we were in terms of feeding them the way that we wanted to and needed to, these kids just wanted to suck the heck out of something all day long to amuse themselves and to make themselves comfortable. And so I think that the overall encompassing rule of never give a baby a pacifier really has to be a baby to baby and baby to mom to baby decision, because so many times this is something that really gives the moms a break. Now, do you use any alternatives to a pacifier, Rob, like the upside down pinky?
Not that I mentioned to the moms.
Yeah, I mean, I'll back that idea, because indeed, from everything I've been told by lactation consultants, an upside down pinky, so what essentially that is you're just presenting a clean pinky, whether it's the mom's or the dad's pinky, held with the pad side upright and letting the baby suckle on that, really can be helpful in terms of helping the baby work through the mechanics of suckling, as long as you're getting the baby to do it the right way. You just have to be, again, careful with hygiene there, and also realize that sometimes you just can't be available to present your pinky 24/7, especially if you're the mom who's trying to get a break.
Okay, now back to that number 6 about exclusive breastfeeding. It's that step number 6 of only breast milk unless medically indicated that gives us pause in how this plays out in real-life situations on these newborn floors. It can cause much distress for mom and thus increase her risk for depression and anxiety, resulting in the sad mommies. Matt and I both agree that breast milk is best for new babies, but the baby-friendly guidelines state that if the mother requests that her breastfeeding infant be given a breast milk substitute, otherwise known as formula, the healthcare staff should first explore the reason for the request, address the concerns raised, and educate her about the possible consequences to the health of her infant and the success of breastfeeding, and basically just say no. Now, if the mom still requests a breast milk substitute formula a second time, then the request can be granted and the process and informed decision should be documented. The problem is that many new moms get discouraged and guilty when rebuffed that first time, so they never ask again. These baby-friendly guidelines go on to say that any other decisions to give breastfeeding infants formula should only be for medical reasons and require a written order documenting when and why the supplement was indicated. Many nurses are not going to wake up the on-call doctor at 2 a.m. to request permission to supplement, even if they feel it's wise. So this may not be the baby-friendly intention, but the reality is that it's pretty much putting a gag order on the skilled, experienced newborn nurses. The nurses are frustrated, and so too often are the moms. I actually took a non-scientific poll on call on a Saturday last month on the newborn ward, and 10 out of 10 nurses strongly did not like the baby-friendly guidelines because of this particular issue with breastfeeding and because the 24/7 rooming in.
Parts of this are really reasonable. So if the mom is requesting that something aside from breastfeeding be offered to the baby, I do think that asking the mom why she's making the request and then addressing those concerns are great. I mean, frequently we in medicine don't ask why. Don't ask, why are you asking that? Or don't ask, like, so what are you hoping to achieve by this? Those two things are reasonable, but to make it a hurdle, to make it emotionally and honestly medically difficult to be able to have these moms take a little bit of a break after they've been informed about the possible risks, I think is just really, it's really daunting for the moms to deal with. And most of them, especially when they're exhausted, to say like, oh no, really, I want that now. They're going to defer.
Exactly, and taking away from the judgment of these nurses who are the best people to be in tune with both the mother's psyche and the baby's health. They may be the first to notice signs of a new mom getting down or anxious, maybe not having a lot of home support, and then at 2 a.m, noticing that the baby's maybe losing a bit more weight than they expected, and the milk is coming in a little bit slower than expected, or the mom is in a bit of pain or on a lot of medications or sleep deprived, etc. And sometimes everyone may be well served to give mom some relief and to give the child perhaps some supplementation. And in fact, a paper in Pediatrics in June of 2013 by Valerie Fleierman et al. Documents that the use of limited amounts of formula early on in some babies at risk can not only help the baby avoid medical problems, but actually improve the rates of breastfeeding long term in those babies. The baby-friendly rules in this area are just too black and white and don't recognize the gray. And this doesn't allow experienced pediatric nurses to use their judgment and do their job to help both baby and mom. Now, when Baby Friendly first started in our hospital a few years ago, I was not really aware that it even started. And my usual practice was always that if I had a mom who had maybe history of postpartum depression or difficulty breastfeeding or was particularly anxious about breastfeeding, I told her that we want to promote breastfeeding, but that being a good mom is not defined only by breastfeeding, and that we'll do everything to support breastfeeding, but sometimes it doesn't go completely as planned. And most importantly, we will make sure that our baby is healthy. It's actually, a message I tell all moms at prenatal visits before the baby's delivered also. So when I see these moms after delivery, I always traditionally told them that, well, if they felt they needed to, just ask the nurses to supplement with some formula. And then I tried to tell the nurses about this also. Most of these moms never needed any supplementation, but I then started noticing that more and more of them who did request it were again initially rebuffed, and the moms did not ask a second time. I'd walk in the morning to a tearful new mom, a frustrated nurse, and a baby losing more weight than expected, and often with jaundice. And sometimes you just gotta feed the baby.
Yes. This is another case of when moms and dads come in to interview me and they ask me what I think of breastfeeding, I tell them I am a huge advocate of breastfeeding, but what I'm not is a breastfeeding zealot. I'm not going to sit there and make rule upon rule for them in terms of this is how you need to breastfeed. The whole goal here is the end point, to have a healthy baby and as much as we can get the best stuff into them, which optimally is breast milk. But on the other hand, I think to put a mom in a position where there's no compromise on any topic here, on any level, is really unfair. It's unfair to everybody, and it's not good medicine.
So, and how I've changed my practice is now when I go in to see the new moms that first day, I tell her that the nurses are not allowed to mention formula supplementation, even if they want to. So if the mom feels she needs a supplement, she must ask for the formula specifically twice and not take no for an answer. I also tell them that, again, supplementation should never be routine, but I don't think it will by itself ruin breastfeeding or cause permanent nipple confusion, although syringe supplementation is preferred over a bottle. Again, as in that study, I think formula supplementation likely improves long-term breastfeeding in some babies and certainly reduces complications like jaundice.
Now, when Rob and I did our recent grand rounds at the local hospital, we really brought this up in a very public way to the hospital staff. And there was honestly some understandable defensiveness there. And we did, in fact, maybe come off as a little bit heavy-handed. But what we wanted to point out through our discussion was that some of these rules are meant to be interpreted by the person who's there on the front lines, meaning the pediatric nurses.
And thus, it may not have been their intention, but the reality was that the nurses felt like it was a gag order, and the policy was not always serving the new moms and babies' best interests. So that's a problem. And it was kind of nice because in the audience, a few neonatologists, a few of the administration said, well, this is a problem if that's what they're thinking, so we need to look in on it. So we felt okay.
Got a little traction. We felt a little justified in terms of picking on them a little bit.
Exactly. We'll be right back.
She was a milk machine. She kept the house unclean. She was the cutest damn baby that I'd ever seen. She had the brightest eyes and the loudest cries. I couldn't get enough of those chubby thighs.
We're back. It's been a while, but we wanted to touch base on some pediatric issues in the news lately. Some of these will turn into full episodes in the near future. So here we go. We are
Penn State.
We are
Penn State.
We are
The world. We are the children.
No, don't do that.
We are the ones to make a better day. So let's start
You just
giving.
ruined it for me.
I know.
Now, we are in Penn State country, so this story certainly hits home. A Pennsylvania grand jury recently released its report on the tragic fraternity hazing death of 19-year-old Tim Piazza this past year at Beta Theta Pi. It's pretty scathing, and one particular line stood out about the shocking apathy of Penn State's administration to his death. Specifically, fraternities were policed by student organizations, not the university itself. Now, to Penn State's credit, they have totally revamped the Greek system and taken control of Greek life and shut down the worst of the offenders.
And while this death was particularly tragic, it's not isolated at all for the 750,000 college kids each year in the Greek system. Senseless college deaths like this happen too often all over the country, and obviously not just in fraternities, but it is more likely in the Greek system. It's also weird to me that in most schools, only the fraternities have alcohol at parties and never the sororities. I think if you're going to have alcohol for 21 and above college students, the sororities probably would be more responsible with policing it, and they would also be in their home turf, so perhaps lessen the chances for sexual harassment and assault. Of course, giving young women preferences over guys to get alcohol at college parties harkens back to the landmark 14th Amendment Craig versus Boren case, Matt, of 1976, which gave gender bias a very important intermediate scrutiny, and all due to the notorious RBG.
Whoa. Who is RBG?
You know, a famous rapper, RBG? Ruth Bader Ginsburg, the giant on the Supreme Court. And thanks to the More Perfect podcast for that little nugget.
Nice.
So, Matt, were you in a frat?
Nope. I was a GDI.
Which means you were rejected.
No. Although, since I didn't try, nope.
I'll never do it.
I was a gosh darn independent, or some variation of that.
I was only in college for 2 years, so I was a GDI. We had our own frat called the Rat Frat because we used to catch mice and have ceremonies in the middle of the night. But the second year there,
that's some kind of social life you got there, capturing rodents. Yeah, how'd that work out for you on the dating scene?
Elder Hall, Northwestern, that was the peak.
Nice.
But my second year, I did join a frat, Theta Chi, just because I wanted a social life, and it was good. And it was a very mellow frat.
So you couldn't stand on your own?
No.
Mm-hmm.
Absolutely not.
That's a dang shame.
Nope. So some have called for the end of the Greek system completely, which has already been done at Williams College and Bowdoin. And there is some merit to the argument that given the hazing and discrimination and segregation and promotion of privilege in much of the Greek system, it's time to end the Greek system. What do you think?
Well, as I just said, I speak as an outsider, so never having been involved with it to any great extent. But the traditional Greek system seems to me to have outlived its usefulness, if it ever had one. I mean, the idea of, for instance, a social service group or a social service fraternity, I'm all for that. And they're now popular at some of the major colleges. And that seems to me to be a viable option.
Well, and maybe because I was in the Greek system a little bit, I'm not ready to end it all, in my opinion. And again, that charity work and camaraderie can be really wonderful. But I do think that significant changes have to be made. And so these are the changes that I would put in right away.
So go back for a second. So
Yeah.
It seems to me that much of the charity work done by frats is kind of in an effort to repay the world for their own debauchery. Sorry, we're drunken slobs, so let's pick up some trash on Saturday down at the park. Come on.
You're basing this all on Animal House, which is a wonderful movie. But
good movie.
All right, we can agree to disagree. But if we're going to keep the Greek system, what I would do if I was king of the Greek system would be 3 things. Number 1, no hard liquor on any college campus, no matter what the age. Yes, 21 and above can get wine or beer, but no hard liquor. Dartmouth and UVA and Providence College have already done this. The truly horrific outcomes with drinking in college seem always to be associated with hard liquor, so I think this would help. Now, some would say that, yeah, the students will just pregame off campus or secretly in their dorm rooms, but I still think it would help. And if they're going to do that, they should also police the alumni tailgating parties. What kind of example to the students are grossly intoxicated alumni? Take the hard liquor from them also. Number 2, colleges need to directly police the fraternities and sororities with little tolerance. Penn State and others have already started to do this. People like to mention about the zero tolerance, but I'm wary putting in a zero tolerance rules too much, because just like with criminal mandatory sentences laws, they can backfire. There's always going to be some gray. These are just college kids and can make mistakes. Although I agree, no forgiveness for drunken sexual assaults. And lastly, number 3, ban all pledging in the freshman year completely. And when they do pledge, starting as sophomores, have really strict no hazing rules, which includes no sleep deprivation and obviously no drinking and physical torture and bullying and emotional harm. And for those, yes, if they officially break that, then that's the end of the charter for that fraternity. I do try to mention to high school students looking at colleges that if the college is on the list of top 10 party schools, then I would be particularly wary. And this list is unofficial, and obviously it's not always under the control of the college. But there's a reasons why some schools show up on that list year after year, like Penn State used to do. Who wants a student coming to your institution of higher learning based on being a good party school? But lastly, if we're going to talk about health issues on college campuses, then they should be addressing the number one way colleges and universities across the country, especially the richer ones with huge endowments, are failing their students health-wise, in my opinion. And that's that most have really, 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 really bad mental health care resources for their students. And Matt, it's amazing. These schools take in thousands of young adults who are at the highest risk in their lives for depression and anxiety and schizophrenia and drug abuse and especially suicide. And they have mental health resources which are a joke. And the students know this. Now, there are exceptions like the University of Richmond Spiders now, but most really need to put some of those millions of dollars into teams of social workers, psychologists, and psychiatrists who solely dedicate themselves to undergrad and graduate student mental health, being proactive about helping those at-risk students, working with the RAs and faculty and student organizations. Just having a talk during New Student Week about mental health is not enough. And yeah, there's HIPAA rules about privacy for these adult students over 17, but they need to somehow make it easier for the parents of these children to get involved early and be forewarned about problems so they know what's happening when their kids come home for break.
Yeah, I feel very, very strongly about this. So you and I haven't talked a great deal about mental health yet, although that's certainly in the cards for us over the next season or two. This is a time when kids are particularly volatile, particularly impressionable, particularly peer-oriented. And so to find oneself in a position of being lonely and sad and overwhelmed and not have any resources, particularly if one's far away from home, is really just an untenable situation for a lot of kids. And I think that the colleges, again, you pointed this out, tuition continues to skyrocket, but what gets left in the dust is mental health services, which really should be a very significant resource of both in terms of availability and ability for people who attend college.
One of my college patients several years ago committed suicide. He was just poorly served by his university. The campus crisis line completely failed him. So parents out there, when you're looking at college choices and you ask questions about the dorm and the meal plan and such, start asking very pointed questions about mental health issues and how they communicate them with you and how they can be accessed with certain insurances and how they can make you feel better that your child will be well served in the most common, potentially lethal medical problem they can have in college, which is depression and mental health problems.
One of the things that I really have a problem with is the fact that even the colleges that have mental health services that they provide for the young people who are on their campuses will oftentimes have a limit in terms of the number of sessions that somebody can have. As if you could quantify somehow everybody into the same box and say, okay, 10 sessions, you should be good now, we'll see you later. This is ridiculous. I mean, there's no accounting for the fact that there are many variables. There's no accounting for diversity in somebody's needs. It's just, you get 10 sessions, and after that, good luck.
Use some of those millions of dollars on extra sessions. In fact, again, moms, dads on those tours of those colleges say, Do you have a limit of sessions for mental health issues? And if they have a limit, that should be a big strike against the college.
Yeah, and this is, I will say, and you'll hear me rant on this over and over again over the next year or so as we continue this discussion, but increasingly we're seeing suffering college students who are coming home from break, or for that matter, coming home feeling like failures from colleges because they just didn't have the mental health support system that they really needed. And this is a modern tragedy, as if there isn't enough pressure out there, pressure that our society is putting on these young people, and then not providing them with a resource, but charging them an arm and a leg for college is just unforgivable.
I agree. I guess we can say it sucks,
Indeed,
right?
it
That
does.
would work. We'll be right back.
Fly, Eagles, fly on the road to victory. Fight, Eagles, fight. Score touchdowns, 1, 2, 3. 1, 2, 3. Hit 'em low, hit 'em high. Watch our Eagles fly. Fly, Eagles, fly on the road to victory. E-A-G-L-E-S, Eagles!
We're just one game away from the Super Bowl and winning particularly ugly. That's it for now, boys and girls. Matt says good night, Moon, and we'll be back soon with some pus and obesity. Again, check out podcastpediatricians.com and tell your friends.
I state your name.
I state your name.
Do hereby pledge allegiance to the frat.
Do hereby pledge allegiance to the frat.
With liberty and fraternity for all.
Amen.
Let me tell you about some friends I know. They're kind of crazy, but you dig the show. They can party till the break of dawn. At Delta Chi, you can't go wrong.
Animal House. Animal House.
Podcast Pediatricians Productions. All rights reserved.